This is Live Well Talk on the COVID vaccine. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health St. Luke's Hospital. COVID-19 vaccines continue to be in the headlines and should be available to certain high-risk populations very soon. In today's COVID-19 update, I'll give you all the latest info we have on the vaccine. Today's podcast is being recorded at 3:30 p.m. on Tuesday, December 8th. I wanted to cover the vaccine today, as well as the possibility of a post-Thanksgiving surge. But the vaccine is in the process of being approved by the Food and Drug Administration. They meet on Thursday, and we could have doses available to go as soon as December 13th. I get a lot of questions about the vaccine. I think there's a lot of myth and conspiracies about the vaccine and the fact that it was developed so fast. But I actually was reading about the development, and what they really did is, rather than doing things in chronological order they normally do that are somewhat related, the things they could do at the same time, they did at the same time, so more in a parallel process. That allowed the vaccine to become available faster than what would normally be expected. The numbers from Pfizer are impressive as far as efficacy, and that is probably the one item that I'm the least sure of, and that is the ability for this vaccine to be 95% efficacious. But let's hope for the best. That would be truly, if the vaccine has that degree of efficacy and prolonged immunity, then this is the beginning of the end for the pandemic. But with all vaccines, there is concern of side effects. The side effects, at this short-term side effects of the COVID vaccine, are patients may develop a low-grade fever and some myalgias for 24 hours following the vaccine, but nothing that is sustained. The patients sometimes can have a headache after receiving a vaccine like this, but nothing that is sustained or would typically result in someone being seen by a physician or clinician. Long-term side effects, not really established at this time because we haven't had it for long-term. So that's difficult to say. Most vaccines cause concerns within 30 days if they're going to cause a concern. So this vaccine has been around long enough that 30-day concern is minimized, short-term side effects. Long-term side effects, difficult to say at this time. There is a population of people that believe vaccines are harmful to begin with, and that they may cause autism and they may have mercury in them. I do not. I support vaccinations and vaccines. Vaccines, I mean, you have the moon landing and you have the development of vaccines. Those are probably two of the most significant achievement of mankind in history. And so anyone to have a fear of the vaccine from some sort of globalist agenda to curtail the population or cause sterility, that is simply conspiracy. For example, I'm going to get the vaccine, and I'm going to recommend that my wife and two daughters also get the vaccine. It really could possibly mark the beginning of the end for the pandemic. The vaccine that we'll receive first here at St. Luke's will be the Pfizer product, which has to be super cooled, and we do have the facility to store that. We will be giving the vaccinations most likely in the Heart Center, and more to follow this week yet on detailing how associates would get signed up for that, as well as physicians in the general public at some juncture. We have taken, from my position as Chief Medical Officer, I have stratified the physicians, and I've broken them down into 4 categories, and I think we'll probably use the same with nursing and hospital associates. And the first category, which has the highest risk, is going to be staff and physicians that have greater than 15 minutes of face-to-face contact with patients that have known COVID disease. Then high risk, the next tier, would be face-to-face contact with patients that have an unknown status as far as their COVID, which would be the first encounter in the emergency room, perhaps some of the OR team, that then now you're getting into these patients are unknown. The moderate risk will be having less than 15 minutes patient care contact at a time with positive, known or unknown. That will help give some direction, and then supplementary status would be that you're employed in the hospital, and the hospital is a risk environment because we have COVID patients here. We're still developing that strategy and that stratification. I anticipate some changes, but we should have a working product by the end of the week to distribute and give some idea of when nursing staff and physicians will receive the vaccine, as well as hospital associates and laboratory staff, radiology staff, EKG techs, respiratory therapy. These people are all in the front line, and they need the vaccine as soon as we can give it when we have it available, which, as I said, maybe as early as doses may be ready to go as early as next week. The vaccine that, as I said, the Pfizer dose that has to be super cool, we are receiving that, but also it is a 2 vaccination series separated by 21 days. And that is common with some vaccines. The Moderna product is separated by 28 days, but they're both two-shot series. So it is important to get that second shot, and they're not interchangeable. You can't get Pfizer for one and Moderna for the other. That is not advisable. As I've stated earlier in the podcast, I really do think this potentially could be the beginning of the end for the pandemic, with the vaccine rolling out by the end of the year and into the early of 2021. We've not seen a flu case yet here at St. Luke's as of today, December 8th. I think there's one in Southwest Iowa, maybe, is the only one that I saw in the state report last week. I think part of this is just the natural variation in the flu cycle. We've had years where we didn't start masking until January. We've had other years where we masked in October or the first week in November. So it does vary year to year, but I think part of I feel very confident that the social distancing and masking and being aware of social distancing and crowded gatherings is reducing the transmission of influenza this year. So that's always a good thing. In regards to social distancing and masking and reduction in transmission, the suspicion is there might be a spike of cases after the Thanksgiving holiday. And I'm not confident that will happen. And let me tell you my reasoning behind that. One, the super spreader events here in the United States have been mainly weddings. A situation where several hundred people are in a building that is smaller with poor ventilation. Your typical household contact or transmission is considered quite low for asymptomatic, based upon a recent study from China. So I don't know if we'll see the spike that we had. That being said, we will be ready for it if indeed it does present. Thank you for listening today. Today's COVID-19 Vaccine Update podcast. For the most up-to-date information on COVID-19, visit our website at unitypoint.org or the Centers for Disease Control and Prevention's website at cdc.gov.
Thank you for listening to Live Well Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.